Hi, I'm Julia Ma, and I'm a Year 1 nursing student. And I'm here with Mr. Graham McCaffrey, and he is a Year 1 liaison faculty member. And we're here to answer just a few questions that you Year 1 nursing students might have. So the first question is concerning options. In the first year, most of our classes are options, but in second year and so on, do we get any more?
Not really. One of the reasons why the program is set up as it is, so you do all your options in the first year, is because you don't have any choice about the schedule once you get into the second year. And the main reason for that is that everything is centered around your practicum placements. So that by the time you've got your actual clinical placements kind of set up in the week, and then you've got courses that where the content's geared around those. You have labs on site here, and then you have the theory courses. The schedule's pretty tight, so there aren't any more options. The only exception to that is when you get to the fourth year, you get some choice about clinical specialties. So you have smaller classes, because there'll be one class that's doing mental health, for example, another class that's doing oncology, which is cancer care. So that's the only time that you get choices about the schedule.
Okay, thank you. So in our first year, we were all able to make our own schedules. So from year 2 and onward, is the schedule just set for us?
Yes, it is. Yeah, and it's pretty tight too. It's a busy schedule. You have some long days.
Okay. And last question is, could you give us some information about your clinical background?
Sure. I'm actually, on most of my career, I've been a mental health nurse. I started off, when I first trained, which is back in England, I trained as a general nurse, so the equivalent of an RN. And I worked for a couple of years on medical and surgical units in London, just to get that sort of basic hospital nursing experience. And then I'd always been interested in mental health, so I went into mental health nursing and did a whole variety of different jobs. When I came to Canada, which is nearly 20 years ago now, I started working in geriatric mental health, so with older adults, and found that really interesting, and did a variety of jobs both in the hospital and in community. And then most recently, I worked at the Foothills in what's called psychiatric consultation liaison. So that's doing mental health assessments on people who are in hospital on a medical unit or a surgical unit, which is a great job because you go all around the hospital and you see all these different units and work with lots of different teams, and spend a lot of time talking to patients about really about some of the sort of emotional and psychological problems they might be having while they're in hospital, basically for some other reason.
Okay, that's all the questions we have, so thank you very much for coming here today.
Okay, thank you.